Hi, everyone. Welcome to the Gut Reset Summit. I'm your host, Dr. John Dempster, and today I'm joined with Shivan Sarna. And Shivan, she is not new to many of you, but she is the author of the Amazon bestseller, Healing SIBO, a TV host and the creator of the SIBO SOS Summits, the Digestion SOS documentary series, and the Gut and Microbiome Rescue Summit, and a number of other summits that she's done. After a lifetime of struggling with health issues, Shivan made it her mission to demystify her own health struggles and to share that information with others who are struggling. And her personal mantra is SOS, save ourselves. And that is what she has helped thousands of people do. Shivan, welcome to the Gut Reset Summit. Great to have you here today.
Great to see you again. Thank you so much. Glad you're doing it. Got to get the word out, man. Got to get it out.
Yeah, and it's been a while since we've chatted together, but we've had some fun over the years doing summits. And so it's great to have you on this one. Let's start off. A lot of people know who you are, but for those who you are new to, please share a bit of your journey and your story, how you got here.
I don't know how many people know who I am, but nevertheless, hi, everybody. I'm Shivan Sarna.
You're well known in the gut space. Come on.
I hope the only reason why I'm going to say I hope so is because I'm really trying to get the word out. So I hope some of my work has reached you. And if not, it's really nice to meet you. I have had a lifetime, as you described, of gut health issues and found out about 2015 of a condition called SIBO, Small Intestine Bacterial Overgrowth. I disavowed it because I didn't like the name. I had been told I had IBS, irritable bowel syndrome, which is also really obnoxious because it's a diagnosis of exclusion, meaning you don't have good news. You don't have Crohn's, you don't have IBD, you don't have, other things. But I was told to take an antidepressant and walk 3 miles a day. In my book, I call that Dr. Walk 3 miles because I could barely move, much less go exercise. I was really also struggling with mold in the television studio where I worked for 20 years. So I was in deep denial about the mold and I didn't know what I was going to do. I couldn't quit my job, but it wasn't even on my radar. What was on my radar was my constipation and my bloating and my fatigue and my discomfort. Now, I'd probably gotten my first exposure to food poisoning, the number one underlying cause of IBS and small intestine bacterial overgrowth, when I was about 5, when I was traveling in India with my parents. And I was never quite the same afterwards. Now, for those of you who are not familiar with what small intestinal bacterial overgrowth is, it's an overgrowth of what's actually normal flora in your body, in your gut, but it has overgrown because of a slowed migrating motor complex, or the MMC, which is the sweeping motion. Consider it like a microperistalsis of symphonizing your gut. When that doesn't move properly for a variety of reasons, including the possibility of food poisoning, even ancient food poisoning, or endometriosis, or adhesions, or scleroderma, or opioid use, even if it was a little bit after a oral surgery, that can slow the migrating motor complex, allowing what would normal bacteria to overgrow and lead to bloating, constipation, diarrhea, alternating constipation and diarrhea, and rosacea, restless leg syndrome, and a variety of other things, including those little buggers eating your food and in some forms malnutrition. There you go, John.
Thank you. This is important to talk about because, a lot of times, and SIBO might be new for some of the listeners, but for those who are experienced with it, we always associate it just with gut issues. Now, we're seeing in the literature more and more than you just alluded to it, rosacea, for example. SIBO can be connected to many, many conditions. And so this is why, this is important to talk about from a gut perspective, but also from many other angles. We want to make sure that small intestine is behaving, because that is like a hot pot of all sorts of nutrients and calories and all sorts of foodstuffs that are coming through. And we need to make sure that this situation is under control. So tell us a little bit more. You kind of alluded to a couple of the main triggers for SIBO, but what are some others that could lead to this?
Well, if you're not familiar with what an adhesion is, then that is, for those of you who are listening, think of if you've ever had, a scar on the outside, that it could be considered an adhesion in a way. It's the internal body's tissue and collagen gathering together to keep you whole, right? To pull you back together. And we love that for a wound on the skin, but it still can lead to a barrier to healing. So there are things you can do to help with that. But on the inside, an adhesion, whether you've been kicked in the stomach by a horse, softball in the belly, like, oh, and falling, seatbelt jamming in the fender bender, things that could trump cesarean, all kinds of stuff. Uterine fibroids, things that could cause scar tissue from trauma to the abdominal area, which then could literally pull the tissue of the small intestine out of place. Even if you have a good migrating motor complex, could move it a little bit so that your plumbing doesn't work as well. So adhesions are definitely a concern and an issue. And it's very important to get tested. The other implications could be things like restless leg, I think I said. There's blood pressure implications. There's all kinds of things that can happen when this overgrows. And the other thing is that even if you have, so I just want to say this, it mimics other things. Okay. Yeah. So parasites looks like SIBO. Candida looks like SIBO. It could be SIFO, small intestine fungal overgrowth. So you have these common symptoms that I just described. Those also work for Candida overgrowth and parasites. So it's really important to get tested. Now, on the worst case scenario, like on the other end of the spectrum, those symptoms can be associated with ovarian cancer. I don't want you to miss anything. I want you to find out what's going on so you can treat it and so you can get on with your life. But you deserve to be well, and it's not something to ignore. And it can lead to iron deficiencies. It can lead to B12, really odd levels of B12 because the bacteria can eat that B12. So you may even have a high level of B12 without supplementation in a serum test, but it's also that your body's not utilizing it. So there's all kinds of health implications. It's important to get it taken care of, and also definitely associated with psoriasis.
Fantastic. Yeah, that's powerful. And, it's amazing. As you were speaking, I was thinking I have so many new patients that come in saying, I have SIBO. I need to be treated for SIBO. And yes, it might be part of their picture, but, you mentioned it's the great mimicker. We often find that there's many, many other things that can mimic a lot of these gut issues that, now that SIBO is becoming more popularized and more well-known, it can also start to go down into other areas. So it is important to get tested. How do you recommend, or what test do you recommend people get tested with?
Definitely a reminder that you cannot tell if you have SIBO from a stool test. That is your large intestine. It can tell you a ton of really cool things, but it cannot tell you if you have SIBO. You can also not find out if you have SIBO from an organic acids test. So please know that. And if you have a practitioner that's like really like, oh, this shows like SIBO, and that's just not the standard. So what you want is a breath test, a SIBO breath test. There are 3 types of gases that it tests for. If you do the Trio Smart by Gemelli Labs, I have no financial relationship with them. I'm just telling you. There's also Aero Diagnostics, which is fantastic. Quintron equipment, fantastic. It is methane producing organisms, hydrogen producing organisms, or hydrogen sulfide producing organisms. And you want to find out if any of those are overgrown. And if you are on the threshold of a cutoff, like, for example, constipation, or methane, which is usually associated with constipation, and you're like, oh, well, it could be negative, that test, but you still have symptoms, then it's a positive. So that's Trio. I would check into Trio Smart, and you can call them or reach out to them in the United States and find out how you can get the test at home, and how, if you fill out a questionnaire with them and maybe give them a little extra moolah, you can have a doctor give you the script through them.
So now that we've been diagnosed with it properly, how do we treat it? What do you see right now in your research as being the most effective ways to approach this?
So Dr. Mark Pimentel out of Cedars-Sinai is actively trying to figure this out for the long run. But in the meanwhile, there are studies, there's a lot of proof that these 3 following treatments work. You don't want to do them all at the same time, and you may have to rotate them, and you may have to do multiple rounds. But Dr. Allison Seebecker and Dr. Stephen Sandberg Lewis have validated thousands of these tests at the center where they used to work together. And it is 3 types, right? One is herbal, one is antibiotic, and one is the elemental diet. Now, the elemental diet is the most effective. It is a liquid diet for about 17 days. And it is amino acids and a fat and a like a sugar source, and it is pre-digested. So when you look at the powder, you're not going to see like protein grams and things like that because it's pre-digested down to the amino acids. It is psychologically pretty tricky. Some people love it and feel great because their body's not struggling to digest the food. And other people are like, oh, I can't wait till this is over. But it does have the track record of being the most efficient, as it does starve the organisms that have overgrown in the small intestine. Now, the herbal approach takes longer. It's about, the study was 4 weeks, and you may have to do multiple rounds. I do suggest testing after each treatment round to see how far you've gotten and if it worked. And there are herbs like berberine, oregano, Alimed, the allicin in garlic. Don't just eat a lot of garlic. Don't just take your typical garlic pills. It's really important, like Alimed, Alimax Pro is usually the brand that's most widely recommended, and make sure you're taking enough. And then Refax. Oh wait, that's the herbs. Okay, we've got, yep. Those are the herbs. And then in 2-week rounds, it is rifaximin for hydrogen, and then rifaximin and neomycin for methane. And then for hydrogen sulfide, which doesn't have as much, research data on it in terms of the treatments, but it's often rifaximin and some form of bismuth. A lot of people are just taking that swig of Pepto-Bismol and getting some really great results.
Yeah, good. Now, these are huge. Now, a couple of questions on this. The elemental diet. What if somebody feels like they're having an adverse reaction to that diet, which might not be common, but I have seen it clinically, and I'm sure you have. What advice do you have for people listening right now?
Sure. For the elemental diet, it's tricky, right? So what's the adverse reaction? Is it die-off? Is it like, you've got so many possibilities here. Yeah. You could also ease into it, replace one meal with, a day for a while with the elemental diet, see how it goes. A lot of times the elemental diet does work, but maybe you have to work through, it's a very specific phased experience with the elemental diet. Like, first couple of days you feel like this, next couple of days you feel like this, then you feel like this. There's a lot of tracking of that has been pretty consistent. So if the elemental diet is not working for you and you're not going to be compliant, then by all means switch and find something that you will be compliant with, because fortunately it's not the only treatment in town.
Yeah, no, very true. I mean, for example, a long time, the low FODMAP diet was the main dietary feature. How do you find the elemental compares to that?
Totally different in that the elemental diet is a treatment for SIBO, and the low FODMAP diet, which I'm so glad you asked about, is to manage symptoms. So they are two totally different things, which leads me to a huge myth that I would love to bust right now, which is diet does not cure SIBO. It is a symptom management tool. So it will help you feel better. There's no doubt about it. If you get off the high fermentable foods, and FODMAPs are high fermentable carbohydrates, your symptoms can get better within like 2 days, 2 to 3 days. It depends on how your motility is and what you're choosing to eat. But after that, and you really want to treat it, you really want to reduce the overgrowth. It's not an infection, right? It's an overgrowth. So there is a slight distinction there. And when you can feel better and deal with the overgrowth, it's definitely fantastic, but you've got to get the overgrowth down. It's easier when you are doing a low fermentation diet, and you will feel better. So definitely look into that. And low FODMAP, SCD diet, Dr. Alison Seebecker's SIBO specific food guide, all fantastic for helping you to reduce your symptoms.
And Dr. Seebecker is speaking on this summit as well. So I know you guys are
I love me some Allison.
Yes.
Yeah.
We're great friends.
Yeah.
Thank you. Now, you touched on a word earlier, the Herxheimer reaction. This is known a bit more as the die-off reaction, and it can happen whether you're using botanicals or herbals or antibiotics. What do you see, and how do you mitigate that for people who might be experiencing a Herx?
I mean, you've really got to decide what kind of state you're in. Like, is your central nervous system really overloaded at that time because you're really stressed out? You might want to ease up and do less. Some people decide to push through it. Charcoal is definitely a great tool for that, for absorbing the toxins from the die-off. Alka-Seltzer Gold is fantastic. Dr. Seebecker is the one who turned me on to the Alka-Seltzer Gold. And there's a variety of things that you can do, but you really need to decide, like, do you need to take a day off of work to stay home and care for yourself? Good idea. Are you super brain foggy? Don't write that report that day if you've got all that brain fog. You're going to need to manage the situation and be prepared for it. So when you're going into it, it's not as stressful. Other people I see, nothing phases them. They die off. Let's die off. It's no big deal. So it just depends on you.
Yeah, great point. You touched on something earlier, a little bit about mindset. Tell us a bit about what we can do to prepare ourselves. What's the best way to get into a good, optimal mindset?
I'm so glad we're talking about this because it's not talked about enough. A chronic condition like SIBO, or just as I think applies to all chronic conditions, most of them anyway, if it's managed, you can feel 100% better than if that chronic condition is not managed. So, you may have SIBO and it may have an underlying condition that you can't fix, in which case managing it, you can feel so much better by having that low fermentation food, by, having more, having charcoal periodically, whatever it is for you, you'll figure it out because there are tools out there. But having that mindset of, I have to have all my medical tests say optimal or positive or negative, whatever they're supposed to be. Like, if you just get in what that piece of paper says, and you're like, I don't want to have anything that's off based on these diagnostic tests, that's going to be really hard on you mentally. So to just be well and to feel as good as possible, and to know that you have to be persistent and that it is a journey. And all of this sounds very cliche, I know, but managing that chronic condition, if you can't resolve it, is better than not managing it. And you can still have a great life. Just might have to work a little harder in certain areas. I don't know anyone who isn't dealing with something.
Very well said. Yeah, fantastic. Now, I just had a little thought here. At the very beginning, I wanted to touch base with you about the difference between SIBO and SIFO. Can we shed some light on SIFO? Because we're hearing a lot more about SIFO now. SIBO is still there, but tell us a bit more about what that stands for and what it's all about.
Sure. So SIFO is small intestine fungal overgrowth. And Dr. Satish Rao out of Georgia is doing phenomenal research on this and is really actively practicing how to treat that in his practice. Dr. Razai and Dr. Pimentel have recently come out and acknowledged, more publicly that, SIFO is definitely a thing and that it is rare, but it definitely does occur. So I'm really glad to hear all that. You can have candida overgrowth in so many different microbiomes and mucous membranes and parts of your body. In the small intestine, it definitely can happen. It's small intestine fungal overgrowth. But it's not, they're saying it's rare. If you have it, it doesn't feel rare. It feels like, oh my gosh, am I ever going to get rid of this? So it's exciting to see that, emerging.
And would you say the treatment?
Emerging.
Yeah. Would you say
the treatment's tricky?
Similar?
No, it's not. So SIFO is fungal, whereas the SIBO is bacterial or archaea, which is not quite bacteria, nor is it a fungus. It's something else. So you would take things like fluconazole for the SIFO. There are antifungals to take in the over the counter herb world as well.
Great. Excellent. So I know you've got your thumb on the research at all times. What is exciting you the most right now with the research in SIBO?
What's exciting me is Dr. Pimentel and Dr. Ali Razai out at Cedars-Sinai at the MASS program there is working on ways to help with the antibodies, the vinculin, the results of having food poisoning that end up slowing the migrating motor complex. They're looking into a lot of that. There was even talk of maybe a vaccine, maybe for food poisoning. I don't know. That sounded really interesting. It was just a comment that he made. And ways to help the migrating motor complex through healing the nerves, as well as working on other treatments, hydrogen sulfide treatment, other treatments. I think it's going to be definitely sooner rather than later. I hope they hope so too. But I think there's going to be some new information about pharmaceuticals to help address the particular bacteria and archaea that are haunting people who have these conditions.
No, that's exciting. Looking forward to that for sure.
Yeah, big time.
How soon should people be retesting? I think you mentioned earlier, just kind of touched on it. Would you say it's every 2 months, every 3 months into a treatment plan?
Well, the treatments last time were from 2 weeks to 4 weeks. So Dr. C. Becker talks about how it really should be a few days after, and certainly like the 14th day or sooner. The reason is because if you haven't gotten the overgrowth down to negative or, 0 or minimal, then it'll have a chance to rebloom, so to speak, and regrow and overgrow. So if you were to test, let's say a month later, you won't know if you made any gains for that treatment. So it's really important to test fairly shortly, if you can afford it, after a treatment, so you can know that it's, how many times you would have to keep going and that kind of thing.
Yeah. So again, it comes down to when you test, you don't guess. And I like the way you said rebloom. We don't want things, we want to get them right down, snuff them out, and so that they don't have any chance to spark up again. What are some other little tidbits and pearls that we're touching on here for helping anyone with SIBO?
Well, please, for the love of all things holy, make sure you get on a prokinetic after that treatment, especially once you get rid of the SIBO entirely. So if you're like doing back-to-back treatments because you retested, now you're going to go do another, and that and so on. A migrating motor complex solution and support is a prokinetic. So it will help your migrating motor complex flow. So here's a scenario. You go and you have dental work done and you are on opioid pain medicine for a few weeks after 10 days or a few days afterwards. That slows your migrating motor complex. So you can have overgrowth of the bacteria that were in the small intestine slowed down enough, depending on what's in there and what fuel it has, to become SIBO after even a dental procedure. So please make sure that you're pooping and you're moving everything along after those dental procedures and whenever you're on opioids. And also, even after like deep anesthesia, that can slow the migrating motor complex down so much that it can lead to that overgrowth. If you have a strong migrating motor complex, then even if you don't have an ileocecal valve, it doesn't mean you'll necessarily get SIBO. So because that migrating motor complex will still do its job so well. So those are just some things, but the prokinetic like Modal Pro, Ginger, Iberogast, and then the script Motegrity, those all have a lot of efficacy in helping with people. The other thing is low-dose naltrexone, which is I'm a big cheerleader for. It is more of a mild prokinetic and does so many wonderful things for your immune system. But if anyone's suffering with brain fog, autoimmune issues, and gut issues, please look into low-dose naltrexone. Their site, I think, is ldnresearchtrust.org. And that is a phenomenal tool that a lot of people are getting a lot of help with.
I've even heard that, back to the sort of traumatic side of things with medications and so forth, but I've even heard if you go through a traumatic event, it can impact your small bowel motility in less than 24 hours. So these are all
concussions.
Yeah.
Concussions, yeah. Definitely. You can, after a concussion, you get leaky gut very shortly thereafter. So you're exactly right. And I'm saying concussions, there are other things certainly that could be associated with, but I know about concussions for sure.
Yeah, there's physical traumas like concussions, and then emotional traumas like just example.
I'm not surprised at all. Rest and digest versus run and flee. Yeah, when you're in that state of stress, your body just shuts down on so many functions to help keep you going.
That's it. Yeah, you can't be in both at the same time. You're either in rest and digest or you're in fight or flight. You cannot have toes dipped in each side at the same time. So pick a lane. I'm going to put you on the spot here, Shivan. What is one of the most memorable cases of SIBO that you've ever encountered or recall?
Wow. Let's see here. I'm thinking, I mean, I run a Facebook group for 26, 20, almost 28,000 people with SIBO. I'm a patient advocate, so I don't have my own cases, but I certainly do know about a lot of cases, and hear from people all the time about their cases. Um, I would say both Allison Seebecker and I have had it since we were 5, and she became a naturopath because of her SIBO. That's actually not true. She was a naturopath and learned about SIBO, and then, or she was in naturopathic school and learned about SIBO, and then that's where she decided to put her focus on. But the the cases that I hear about that are so heartbreaking is when they're misdiagnosed, when their doctor says that SIBO doesn't exist, when the doctor says, you know, oh, it's a myth, or, just that's what's really memorable for me, John, because it's so upsetting, because it does exist. The science is there. Do your research, go onto PubMed, search Pimentel. You'll find it all, Rezai, you'll find it. Rao, Dr. Leonard Weinstock, amazing. There's just so many validations out there now, which is great. So for me, the most memorable is when people do not get seen, heard, and believed. That breaks my heart. And that's part of my mission, is to help people save themselves, take their own power, get acknowledged. Even if you're walking into those doctor's offices like I used to do with studies, and you have a doctor that goes, "Oh, thanks, I didn't learn about this in medical school. All right, let's do this," and they'll take it on. So the ones that break me the most are the ones that were not believed.
So very true. I can't underline that enough. Shivan, where can we find you online, for everyone who's listening right now? Where can they learn more about you?
Oh, thank you. So SIBOSOS.com, as well as ShivanSarna.com. But for all things SIBO, for me, it's SIBOSOS.com. And we have courses there, and my book, Healing SIBO. So you can continue your education, and don't give up, because there are answers out there.
Thank you for everything that you are doing in this world, and for SIBO sufferers and beyond. So thanks again for hopping on the summit today.
Thank you.